Basically, the lumbosacral junction is from this region, this is the lumbar, and then sacral region, from here to here. Movements of the SI joint, movement of the lumbar spine. So not only does it give stability, but it also gives a great type of motion as well. Something called coupling motion. This is the spinous process right here. The spinous process are supposed to be in good alignment. So when Ethan actually bends to the right, what ends up happening is the spine doesn't just bend, it doesn't just do this, but the spinous process starts to bend towards the side of bending. So it does this. Now when he actually bends to the left, the spine starts to bend to the side of the curvature. If this is neutral, then the spine is actually in pretty good alignment, but the sacrum could possibly cause tilting and twisting, and with the twisting and tilting, it could lead to some curvature of the spine. The sacrum, you have something called sacroiliac joint, which are these joints right here. These sacroiliac joint attach this bone called ilium to this bone called sacrum. It has a motion that allows kind of forward flexion, extension. It also creates internal rotation. External motions are like joints that's supposed to move very proportionally. Sciatic nerve, if you were to kind of look at the lower back, it starts from the lower back region, it travels to the buttocks, and it goes down to the hamstring, down to the back of the calf, into the heel. The daily activity that could create some sciatic nerve problem, it's not just sitting, but let's say you carry a wallet, you put it back in your pocket, and you sit down. One side of the pelvis is higher than the other. It creates the lower back and the sacrum to create a tilt. It could cause a lot of stress to the sciatic nerve to the side as well. Damage, injuries, improper lifting, too much weight gain in front of the stomach can cause a lot of pressure to the lower back. The piriformis muscle starts at the sacrum region, and it creates a triangle which connects to the hip. And this muscle, the action of this muscle allows his foot to externally rotate and also abduct. If the sacrum and the lower back is positioned differently, it can cause a lot of tightness of these piriformis muscle. And the nerve that starts from here, which is the sciatic nerve, they typically travel underneath the piriformis, and the tight piriformis can cause compression to the nerve, which creates sciatic nerve pain. So when he's actually doing this, typical motion is he's going to do this, and that's going to create tightness to this muscle called psoas muscle of the lower back, which also puts stress on the sciatic nerve as well. You know, having a good posture, carrying the backpack on both shoulders versus one side, or having an uneven posture could create a lot of stresses to the lower back as well. This sacroiliac joint right here, there's a ligament called SI joint ligament, and these ligaments are like elastic. The person is sitting down chronically like this, the elastic band can overstretch, and that overstretching of the ligament can cause inflammation. So chronic stretching of the SI joint can cause inflammation to the joint and cause irritation to the sciatic nerve as well. It's so important about abdominal strength. Okay, when people have back pain, people usually wear back brace, right? And when you wear a back brace, it actually takes the pressure off the back, right? Same analogy, if the person does not have strong abdominal muscle, and let's say the stomach starts to kind of sag out, then what ends up happening is they're putting too much stress on the back. Strong abdominal muscle, it creates a intra-abdominal pressure, which takes the pressure off his back. They have sciatica, they have piriformis syndrome, because their posture starts to do this, and it doesn't create a good support to the back. So having a very strong core in the abdominal muscle creates great stability to the back as well. Anatomy of discs. So this is a model of a disc, and this is a normal disc. When you look at the disc, you have the center space and the peripheral space. This is called nucleus pulposus, and this is annulus fibrosus. Age approximately 13 and under, people actually have direct blood supply going to the disc. So when you have direct blood supply, the disc gets proper nutrient so it doesn't degenerate. After age 13 and 14, the blood vessel that travels in to the disc starts to disappear. You can actually get nutrient is through proper motion to the spine. Move and it causes restriction, then you don't get something called diffusion, and the blood vessel and the nutrient starts to get diminished. The disc starts to starve, the nucleus pulposus, this center, the water level starts to reduce, it starts to shrink. Look a little bit more dehydrated, and the outside fiber, they start to put a lot more stress and it starts to cause fissure or breaking of the disc. Dehydration leads the disc to create more damages and eventually create something called disc bulge or disc herniation. So this is a peripheral lateral herniation, but the herniation could actually happen central as well. The disc completely dehydrates and degenerates, leading to a lot of bone spurs, and this is when people have a lot of restriction, they have chronic pain. We want to make sure the body stays within this range. And this is the reason why we're doing this workshop. Okay? The body starts to get quite weak, and it leads to the vertebra start to shift forward. It starts to kind of move forward. And so when it starts to move forward like that, the spinal cord, which is this junction right here, and typically they're supposed to kind of travel right through the circle right here, the canal starts to occlude. So it causes pressure, which leads to compression to the cord, leading to bilateral leg pain. If it starts to kind of tilt this way, the spine starts to rotate, and because the vertebra is much thicker at the front, it leads the spine to create something called compensatory scoliosis. So it starts to kind of curve this way. So when the spine starts to curve this way, what happens to the nerve? It gets overstretched, overcompressed, leading to sciatica pain as well. So when people have sciatica, it's a symptom. But the thing is you got to realize what exactly is causing sciatica. So what are some of the clinical management? So first of all, as I mentioned before we do any type of treatment, we need to understand where it's coming from. So typically we ask people history. Did you fall down? Are you sitting a lot? Have you gained a lot of weight? Have any injuries? Did you have any back injuries? Examination. I do a lot of orthopedic tests, range of motion, muscle tests. Dr. Wu does, Chinese traditional pulse reading, tongue analysis. We also take x-rays. X-ray shows us degenerative changes, curvature. These are very important information. And then we get into treatments. Next stage is how do we balance out the muscle? How do we make sure your muscle is much more flexible and much more stronger? And our last goal is your disc degenerated? Is your disc thinning out? We have something called spinal decompression. It's a very specific table that creates specific decompression to the area of disc herniation and disc degeneration to create lubrication and nutrient to help re-nourish. Along with a proper alignment, the disc actually gets much more healthier and becomes much more resilient. What's the difference between manipulation and adjustment? Okay? Some people say, well, I have my child who steps on my back, it makes cracking noise, and it feels good. They have no idea what they're doing, and it can actually cause more harm. And when you're stepping on the person's, like generally, the area that's nice and easy, that's moving, starts to pop and crack. That's called general mobilization or general manipulation. There's a lot of things that we do before we do an adjustment. So to do an adjustment, it's very specific. We want to try and treat the area that's got a problem. Right? When we correct the spine, your body actually gets corrected. So there's a huge difference between manipulation versus adjustment.
Urinary bladder meridians, which run from the head, your neck, and down to the back, and to your lower back area, and your sacrum area, and the hamstring, and the lower leg. And another meridians really relate is to the gallbladder meridians, which also run from your head on the side of you, and then the lateral side of your lower leg. Chi and blood stagnation, and the cold dampness, and the deficiency of the kidney function and the liver function. One is the chi and the blood stagnation. It can cause from injury or surgery.
Chi and blood stagnation. Stagnation means the circulation is stopped. What I explained, disc herniation, improper lifting, all these things causes the circulation of the nerve to not flow well.
Acupuncturists, in the same time, we will use the cupping, the fire cupping, to warm up the meridian.
And in my side, I would use something like Graston. It's using a tool to help break the scar tissue down. And also some of the tables allow movement to increase circulation as well.
The body maybe have a cold and dampness which block the meridian for the circulation. People get age or repetitive repeat exercise. It can also damage. We can use the massages to warm up the meridians to dispel the cold and the dampness.
Heating around that area to increase circulation and blood flow as well. So this is a very, very important technique.
Very important and very effective.
And the thing that I use heat pack. We use moist heat pack, and also we use laser to help speed up the blood flow, speed up the circulation. But as the person gets older and they have damages for a long period of time, it takes time. And they also need a little bit more extra energy.
It's called the TDP RAM, which here you can see at the plate, the place. By the infrared, you can plate, which is very essentials of the mineral we have in the body. By using this treatment RAM, it also creates more nutrient for the cell of the body. Warming up, by warm up your palms, and you can rock it. So you do it from your lower back to your sacrum area. Is to improve, to stimulate the acupuncture point, to do it daily, to improve your internal organ function, to prevent the sciatica problem. And Dr. is on here, you can see it. So just inferior of the fibula head. So
Ethan's leg, GB34 is right here then, right?
Yeah, so in here. So we do a little bit.
This is actually a very effective point for sciatic nerve problem. You can rub this area, plus you can urinary bladder sinew, right?
Yes.
Right there. Warm this up, then apply pressure here.
Yes. Saturate here to relax your whole body.
Some of the stretches that person could be doing to help alleviate some tension. You can put his foot right on the roller, and you can use a foam roll, like a towel or a belt, okay? And as he starts to pull, it creates a traction. Once he creates a traction, he's stretching the backside of the calf into the hamstring. Now, to make it a little bit better, more stretch, he can slightly lean forward as he starts to pull a little bit more. He can hold on using a towel or a belt or whatever it may be. Then he could use it by kind of pulling the leg and to help stretch the calf, stretch the hamstring, and then as he dorsiflex even further, it creates more stretches. Now, some people who have acute flare-up of sciatic nerve may not be able to go this far. You may actually have to do this, but if you have a little bit more flexibility, you can do this to help stretch something called IT band. So he grabs over here and supporting the left hand, and just gently kind of rock side to side to help loosen up the IT band. This is really good. And then you can kind of roll in the front side of the thighs as well to actually loosen up the IT and the anterior component as well. Over. Now he grabs the bottom of the thigh on both sides and he brings it up. Now, as he does this, not only is he cross it over, pull it up and up. He's stretching the right side. Now, some of you may have a hard time doing this. Alternate over, okay, and lean forward. So same type of stretch. He's using the gravity to help stretch the piriformis as well, okay? And lean forward. Very good stretches for piriformis. And then lean forward, and that creates overall stretch to the back, which according to Chinese medicine is governing vessel, right?
Yes.
So governing vessel, urinary bladder, gallbladder is all stretch. sciatic nerve, spinal cord, exiting from the lower back. You can use a towel, grab, and lean forward and stretch. Okay? Please grab the knees. And this allows, go ahead, back and forth, allows kind of massaging of the back. Just like how Dr. Wu said, kind of rub the back.
Yes.
You can actually do this to help stimulate the lower back. That stretches the conception vessel and also all these different type of lung, meridian, heart meridian. I think the key thing is before you go ahead and do all sorts of exercise and try and help yourself, if you had some problem for a long period of time, I think it is a good idea to find out what's causing those problems at the time, along with other things that we've been doing some presentation on.
Yes.
And I'm glad some of you are giving us an email and calling us and asking questions, and that's what we're here for. But if you have any questions, please contact us at info@centurywellness.ca, and you can check us out on centurywellness.ca website.